Assalamu alaikum and good evening, dear viewers. Welcome to a brand new episode of Harmony of Life. Our main topic for the evening is diabetes and CVD risk. We'll be having Dr. Nabeel and Naqshbandi. In the beginning, I'm Walid Saleh, and with me is my colleague May Abdusamad. May, good evening.
Good evening, Walid, and to all our viewers. Please be upon you. Welcome to a new episode from Harmony of Life. Today, new issues very important to all of you. I invite you to enjoy your more evening with us in Harmony of Life. Our first segment was Twitter and a variety of opinions. We speak about coffee. What about coffee? You use coffee every day, not every day. How many times through the day? I think variety of opinions, and I think that we have a report now, Walid.
Yeah, we're going to start off with our segment, and we are going to take a look at the tweets that we have on coffee, the habit of drinking coffee, and what people who drink coffee have to say about their habit. Let's take a look. And that was Dr. Muna Sanan with her segment, Your Health, Your Wealth, talking about liver disease, or actually kidney health. Now with our main topic for the evening is cardiovascular disease and diabetes. Now cardiovascular disease is the #1 risk factor and complication affecting diabetic patients. 2 out of 3 diabetic patients die of a cardiovascular disease related complication such as heart disease or actually a heart attack or a stroke. Although clinical guidelines put people with type 2 diabetes who need glycogenic and lipid therapy at the same risk level as those with coronary heart disease, nearly 40% of eligible patients do not receive stated treatment. And people with diabetes are 2 to 4 times more likely to have a heart disease than people without diabetes.
I think our viewers, Walid, tell us important and valuable information, but we have now our guest, Dr. Nabeel Naqshbandi, diabetes and CVD risk. This is the issue for today. Welcome, Dr. Nabeel, and happy to be with us in Harmony of Life.
Thank you very much for this interview, and I hope we have very good information to give to our viewers.
When I say the subject for today is diabetes and CVD risk, at the first moment I ask you what CVD risk, what we mean by CVD.
Yeah, CVD, it's the abbreviation of the cardiovascular disease, okay, which is also associated mainly also with diabetes, with high cholesterol and high blood pressure.
Yeah. My first question to you, Dr. Nabeel, what are the percent of diabetes in Kenya?
Okay, it's according to some international numbers, more than 90% of the Saudi adult population is suffering from diabetes. This places Saudi Arabia as the 7th worldwide of having diabetes through the population, the 7th highest, which is really high percentage for having diabetes as a disease for the population.
Yeah.
You said 90 or 30?
19.
19, okay,
19.
good. Well, that's even less than 30. I'm glad. I thought 90.
Yeah, no.
My eyes went. Well, what's the current mortality rate for diabetic patients with a chronic diabetes?
Okay, we have also some numbers about 15,300 something people died yearly from diabetic complications, okay? And this is a real big number to have in such a country like Saudi Arabia.
Now, diabetes doesn't, I mean, okay, diabetes kills, but it doesn't kill because you have low blood sugar. It kills from a complication usually, right?
Sure.
Like a heart disease or
okay,
like a stroke.
Yes,
that's how it works.
Yes, because it's one of the complications. It causes something like this, okay, like the stroke, or like the diabetic coma. Sometimes the hypoglycemia when happened, the hyperglycemia when happened. This is one of the things which is we want to prevent as an industry by having good treatment for diabetes.
Yeah. From a point of view, what is the mortality rate of diabetic patients?
Okay, we already mentioned about 15,000 300 something died yearly from diabetes complication. And as we mentioned also, it is very high, okay, because it's also associated with another diseases like
heart attack or blood pressure. Yeah.
Well, Dr. Nabeel, as a pharmacist, in terms of the pharmaceutical industry, we already know about the medications that are available in the market to control the blood sugar levels, but in terms of cardiovascular disease, how is the pharmaceutical industry advancing in terms of reducing the incidence of CVD complications in diabetics?
Sure. Okay, let us have it. I believe we have two big arms in this industry to help to treat the diabetes. First, the diabetes, as maybe most of the people knows, that it is type 1 and type 2. Type 1 is insulin dependent and type 2 is non-insulin dependent. If we talk about type 1, which is about 10% of the people, okay, the companies, the pharmaceutical companies who produce insulin, human insulin, they are really doing a very good job to give the customer or the final user for the insulin how he can use it easily without any complication. Okay. From the other side, the type 2 diabetes, which is about 90% of the people having diabetes, the new chemical entities, the new innovative drugs, it is usually discovered by the pharmaceutical companies, and also they try to register it as soon as possible in Saudi Arabia, so to give Saudi Arabia and the people who suffer from diabetes the new medicine, okay, the new group of treatment, of drugs, okay, to treat the people. They want to register it as soon as possible to have the privileges with less complication, less side effects, and of course high efficacy. This is one arm. So to have a good product, this is one arm. As MSD, okay, we do have one of the new innovative product. Januvia is doing a very good results for controlling blood sugar. Yeah. And also to reduce all other factors, risk factors for cardiac problems. The other big arm from the pharmaceutical companies is how to be with the community, okay, to increase the awareness of people about how dangerous is the disease, and how can they reduce even the use of the medicine itself, okay, being to predict what if this guy has of the patient, or the patient has the same family problems, or there is some increase on percentage to have diabetes, or to have some cardiac problems, or to have high cholesterol also, which is also covered by our company for high cholesterol, high blood pressure, and also diabetes, which also one of the risk syndrome for cardiovascular disease and diabetes. So being part of the community, helping the community to do this is very good. One of the main issues and the main program has been happening with the GCC Executive Office in Saudi Arabia. Yeah. Okay. Dr. Tawfiq Khoja, the head, His Excellency Dr. Tawfiq Khoja, the head of this office, they have a very clear and beautiful program for the non-communicable disease, okay, which is diabetes is there, high blood pressure is there, okay. This is to make it simple to the people, okay. There is no bacteria or virus, okay, behind the diabetes, or behind high cholesterol or high blood pressure, okay. There is not. It comes maybe sometimes familial, okay, and it comes sometimes without reason.
It's just like an organ failure or
something
from lifestyle. And
yes.
So on. Yeah.
And lifestyle after this. Yeah. So to make the lifestyle, the harmony of life here, we are in the same program, talking about lifestyle, talking about how can we increase the awareness of the people and the awareness of the normal people about obesity, about
I mean, no matter how strong a pharmaceutical company is, the only way you can really, no matter how much their efforts and their progress, the best way they can really tackle something is by creating awareness and preventing it in the first place.
Yes.
So,
participate in this community service, okay? And thanks God, me myself and all members of MSD is one of these good people, I hope, doing these programs with the officials.
Well, if we're going to go with a report, and then we'll be right back to tackle this discussion.
Sure.
Thanks. And we're going to go with the report. Stay tuned.
Heart disease and stroke are 2 to 4 times more common in people with diabetes. They can also strike at a younger age in people with diabetes. By getting daily physical activity, eating a healthy diet, and taking your prescribed medication, you will decrease your chances of having a heart attack or stroke. Arteries are blood vessels that carry oxygen and nutrients throughout your body. Your blood also contains cholesterol and sugar, known as glucose. Cholesterol, known as LDL, builds up and forms plaque in the walls of your arteries. High blood glucose levels increase the rate of plaque buildup, causing the inside of the artery to become narrow and hard. Plaque can cause damage in 2 ways. It narrows your arteries, decreasing the blood flow to the rest of your body, and sometimes it breaks off and causes a blood clot. A blood clot can completely block blood flow to the organ which is being supplied. When blood flow is cut off from the heart, it causes a heart attack. When blood flow to the brain is blocked, it results in a stroke. The good news is that you can control several of the risk factors that lead to heart disease or stroke. The first risk factor is abdominal obesity. This is a waist measurement of more than 102 centimeters in men and 88 centimeters in women. This measurement guideline can differ according to your race, so check with your healthcare provider to determine what is appropriate for you. By losing 5 to 10% of the fat around your waist, you will reduce your risk of having a heart attack or stroke. The second factor you can control is your blood cholesterol. There are 2 sources of cholesterol. The first is produced by your liver, and the second comes from the food you eat. Eating fatty foods can raise your cholesterol level, but your body does require certain good fats. The third risk factor you can control is your blood pressure. Have your blood pressure monitored regularly and work with your doctor to maintain a reading of 130/80. High blood pressure is called hypertension. Hypertension causes your heart to work harder to pump blood. This puts a strain on the heart and blood vessels and can increase your risk of heart attack, stroke, eye problems, and kidney problems. The fourth risk factor you can control is smoking. Smoking greatly increases the risks associated with diabetes, increasing blood glucose levels, blood pressure, and some types of cholesterol. Smoking can heighten your risk of kidney and nerve damage, heart attack, stroke, and infections, and can cause erectile dysfunction. It is important to have your doctor regularly monitor your blood pressure and cholesterol levels. In addition to healthy eating, leading an active lifestyle and taking medications suggested by your health care provider, it can help lower your risk for heart disease and stroke.